general mechanism of action through the receptors. Through the receptor. Now first we can see the what do you mean by the receptors. The receptor are the molecules. It's a micromolecule. Micromolecule in the sense it should be the big molecule. You can see by the this molecule it should be present. This receptor is a micromolecule. This molecule it should be present in the cell membrane. Or in the cell with drug interact and produce the desired action. It will be desired. Now receptor initiate biochemical and physiological changes that are characteristic of the response to the drug. Basically discuss now receptors. Receptor is a micromolecules. Drug receptor is a drug receptor are the micromolecule. It should be present in the cell membrane or in the cell, and then they interact with the drug. They produce the desired action. But which type of the action? The receptor, it should be the changes take place. The biochemical changes and the physiological changes take place. Drug interaction to the receptor, and then the changes take place and they produce the desired effect. Or you can say the effect. Another you can say the maximum effect. The drug receptor interaction is highly selective. Drug receptor interaction is highly specific and selective phenomenon. Like lock and key systems. Drug receptor is interact. They form a complex that is a very specific and selective phenomena, and they broadly compatible to each other like lock and key system. You know the lock and key system. Last year I was taught to you enzyme, and the enzyme interact with the catalyst. They form a enzyme catalyst complex. They are bind. They can bind by lock and key model. See the as compared to for enzyme. E indicates the enzyme. It should be like that. And these the catalysts act by the substrate. Enzyme act as a catalyst. Enzyme bind to the substrate. They form a enzyme substrate complex. Enzyme substrate complex, and they act as a lock and key model. They act as a lock and key. They made for each other. That substrate is there. It's a enzyme substrate. They form. They bind. They are flexible. Substrate can bind here. Enzyme and the substrate complex. That system is called as a lock and key system. Similarly, the drug interact with the receptor broadly. They are bind together, lock and key systems. Now you can see the number of receptor, so many receptors present in the body. They can identify in the systems. They are having the subtype also. Now give the reading. See the drug receptor interaction. The first drug interact with the receptor, then they produce the effect. Drug receptor interaction first. Now this is the drug. Now here is the receptor. Drug interact with the receptor and they produce the effect. Now these are the drug receptor they produce. The effect may be intrinsic, effect may be inhibitions. Sometimes they produce a desired effect, sometimes the drug and receptor bind to each other. They does not produce any effect is happen. So many types of it there. Now first you see first drug interact with the receptor. Drug interact the first receptor and they produce the effect. Now the ability now the drug receptor drug receptor drug receptor they form here having the ability the ability of drug bind to the receptors. That drug having ability, this drug ability bind to the receptor. These are bind. Drug bind to receptor due to affinity. And they generate the effect. Effect is called as is called as efficacy or intrinsic activity. Now this is the basic part. Try to understand properly. It's based on all the next interaction is based on that theory. See very carefully. Again, I repeat, drug interact with the receptor, they bind to drug receptor complex because they are having the affinity. Affinity means the sense of they are having the, they made for each other, like they form a complex. They are having the tremendous affinity. Now for positive goes to the positive, negative goes to the negative. These are the pole dipole movement. Now they are having the affinity, they join together, and that is called as the high affinity. Receptor get bind, drug bind to the receptor because of high affinity, and then they generate the effect. They produce the effect or generate the effect, and that is called as the efficacy. That is called efficacy, means desired effect or intrinsic activity. Simple language say the maximum activity, optimum, maximum activity. Efficacy, intrinsic effect, they produce the effect. That effect should be the maximum, intrinsic effect, optimum. Again I repeat, the first drug interact with the receptor, they produce the effect. Now in case the drug bind to the receptor, they form a drug receptor complex because of they having the affinity to each other. They made for each other. So many film you can say, hero and heroine say we are made for each other, बाद में कुछ भी हो. Like that they having the tremendous affinity, then they generate the effect. That effect should be the efficacy or intrinsic effect, that is maximum activity. According to this theory, drug acting through receptor are, now first agonist, drug bind to the receptor, they form a complex because of bind drug receptor complex. Why they form a complex? Because of they having the affinity, bound to affinity, and they produce the maximal intrinsic activity is called as the high efficacy. Maximum effect means high efficacy. They produce the maximum effect. Okay, is called as the gonist. Do you understand? What do you mean by the gonist? Simple. Drug interact with the receptor, they form a complex, they bind to each other because of they having the affinity. After bind the affinity, they produce the maximum intrinsic effect is called as the agonist. Example: acetylcholine, adrenaline. These are the neurotransmitters, and this histamine is the biogenic amines. It acts in the body, is a self remedy, is also called as the itokites. These are the agonists is present in your body. You understand? Agonist. Next you can see the antagonist. Next interaction, drug receptor interaction according to drug receptor theory. Second is a antagonist. Now here, what happened in the antagonist? This is the drug, this is the receptor. The next step, drug and receptor bind to each other. Drug indicate for D, R for receptor, they form a complex. Because of why they form a complex is the affinity. Next, after this complex generate no intrinsic activity. No intrinsic activity means no effect. Is called as antagonist. Generally, antagonist is may be called as blocker. Is it correct? Yes. Example: atropine, propanol, naloxone. Example having the marks. You must be always remember the example. Now the next drug interaction, that is the second. First is agonist, second is antagonist, and third partial agonist. Again, drug receptor. Drug first interact with the receptor. Because of the having the affinity, they form again complex. Same previously you have to see drug receptor. D indicate for the drug, R for receptor. They form a complex because of they having the affinity, and afterward they generate the this word is wrong, but for partial effect, in partial effect, or it is wrong. It is not for understanding purpose. What is a partial? Maximal intrinsic activity. For mathematically you can say the gonist is produce the maximum activity, means 100% desired effect. is the antagonist, no effect. You can see the 0. Partial agonist is 50%. As compared to the gonist, the partial gonist, as compared to the gonist, the partial gonist activity should be the sub-maximal, in the sense of less than gonist, 50% intrinsic activity. Example that partial gonist is example. Partial gonist example malorpine. This is a common example. Now drug receptor interaction, according to that theory, they are having the gonist. See the gonist. So like that you can see. The gonist, drug interact the receptor, they form a complex. Because of the affinity, they produce the maximum effect. Means high, because of high efficacy, they are having the give the desired effect. Maximum effect, you can say the desired effect. That effect called the desired effect. Example: acetylcholine, adrenaline, histamine. Now the antagonist, as compared to the gonist, drug first interact the receptor, same they form a complex because of they having the affinity. But after, in the antagonist, after affinity, they does not generate any effect. Their intrinsic activity is 0. They does not produce any effect. That's why it's called the blockers. Antagonist blocked by the gonist. See the example: atropine, propranolol, nalorpine. Acetylcholine blocked by the atropine sulfate, adrenaline blocked by the propranolol. They blocked by the beta receptor, beta 2 receptors. Beta 1, they block by beta 1, that generally in beta receptors. They are that. See the difference. Gonist produce the maximum effect, gonist produce the maximum effect, antagonist there is no produce any effect. And the next interaction is a partial antagonist. Drug first interact with the receptor, they form a complex, drug receptor, and after generate the partial effect. Partial, his word is not good. Scientifically don't say the partial, but you also say scientifically sub-maximal intrinsic effect in the sense of 50% intrinsic effect as compared to the gonist drug. Okay. Now see the receptor. There are now receptors. There are the different receptors in the body. Different receptor in the body interact with the different drug. Specific drug interact with the specific receptor. The drug receptor form a chemical bonds. They bind to each other. The formation take place. A chemical bond formation take place. Their bonding indicates duration of action. The nature of bonding or drug receptor are included. The bond may be drug receptor bonding are covalent bond, ionic bond, hydrogen bond, hydrogen bond or van der Waals bonds. Covalent bond is very strongest bond. Their duration, their action depend on the bonding. Suppose drug receptor and the covalent, their action should be the duration is long. Ionic compared to the less. Hydrogen is a breakable bond. The duration of action is less. It has proposed that the intensity of action is proportional to the number of receptors occupied the drugs. And there could be the maximum effect.